Long-term surveillance and treatment outcomes of metachronous gastric cancer occurring after curative endoscopic submucosal dissection. Introduction. Endoscopic submucosal dissection, ESD, is an effective minimally invasive treatment for early gastric cancer, EGC, which can achieve unblocked resection of large or ulcerated lesions. Several studies have shown excellent outcomes of gastric ESD, both in the short and long term, for patients who met the absolute and expanded histological criteria for curability according to the Japanese gastric cancer treatment guidelines. However, most of these data apply to the initially treated EGC, and the outcome of metachronous gastric cancer, MGC, occurring after ESD is largely unknown. The cumulative incidence of MGC after endoscopic resection for EGCs ranges from 5.2% to 14.0% in patients who have undergone endoscopic resection. As more EGC patients are being treated with minimally invasive endoluminal techniques that leave the at-risk native stomach in place, it is important that we understand the outcomes of patients who develop MGC. This retrospective study evaluates the long-term surveillance and treatment outcomes of MGC occurring after curative ESD resection for EGC. Background and study aims. As more early gastric cancer, EGC, patients are being treated with endoscopic submucosal dissection, ESD, it is important to understand the outcomes of patients who develop metachronous gastric cancer, MGC. The aim of this study was to evaluate the long-term surveillance and treatment outcomes of MGC after curative gastric ESD. Patients and methods. The study included 1,526 consecutive patients who underwent curative ESD resection of EGC. They were generally followed by annual or biannual esophagogastroduodenoscopy. The risk factors and treatment outcomes for MGC were assessed along with the 5-year, 7-year, and 10-year cumulative incidence functions of MGC and disease-specific survival, DSS. Results. During a median follow-up period of 82.2 months, 238 patients developed MGC post-ESD resection of EGC. The 5-year, 7-year, and 10-year cumulative incidence functions of MGC were 9.5%, 13.1%, and 22.7% respectively. Male sex and multiple initial EGCs were independent risk factors for MGC in the Cox proportional hazard model. Of the 238 patients with MGC, 215 were treated with endoscopic resection, of whom 183 achieved curative resection, although one patient later died of his initial EGC. A further 14 patients were treated surgically, 3 had metastatic disease and received palliative chemotherapy, and the remaining 6 were observed without any intervention. A total of 7 patients died of MGC, 5 at least 5 years after their index ESD. The 5-year, 7-year, and 10-year DSSs were 99.2%, 98.6%, and 92.5% respectively. Conclusion. The incidence of MGC increases with time after curative gastric ESD. Therefore, surveillance endoscopy should be continued indefinitely.